All right, and our final is Dr. Robin Johnson. And she's here to answer what I believe is the most important question is, how do I get vaccinated? And she'll discuss supply and demand and also provide some of the differences between the two, Pfizer, Moderna, and the newly approved J&J. And she will give you a very huge listen up, and a very huge foot stomper. Dr. Johnson.
Thank you, Mr. Lewis. I am really honored to be here tonight and to join you in this conversation. It is something that I have been really passionate about. As an emergency physician for 24 years, I've seen many of the things that arise in our communities, from health and social risks. The ED is truly a litmus test of what's happening in culture. And these experiences moved me to advocacy in healthcare, really addressing emerging issues and really striving to find ways for access to care at the right time and the right place. Since December of 2019, we began tracking this virus as it emerged in Wuhan, and then we began seeing our first cases in March. And I have to say, it's consumed much of my time and energy over the last year. Not only for me personally as the medical director, as we've been trying to learn about a novel virus, learn how we can protect our community and educate our community, but also in my family. I have a daughter who's a nursing student, has been serving as a CNA on the COVID wards, and my husband, who's an ICU physician. So daily, they have been walking into the front lines in the battle against this virus. And then my colleagues, as emergency physicians and surgeons, intensive care docs, have been on that front line. So probably one of the most profound days for me in this past year was early December, when we saw the first vaccines come forward into Colorado Springs. And it was one of my emergency physician friends who actually stepped up and took that first vaccine. It was a moment of excitement, celebration, joy that we had light at the end of the tunnel, that there was hope beyond just some of the messages that I feel like are on auto after the last year, to wear our masks, to maintain our social distance, to wash our hands, and recognizing that for us as a human and as a community and culture, that we need so much more than that for full human flourishing. And so here's an opportunity for us to add one of the most powerful tools of public health preventive measures into that layered approach. And as we layer on our vaccine and reach herd immunity, meaning enough people to really break that transmission of virus, that we'll be able to begin lifting some of these other measures, reconnect our economy, reconnect our social structures, reconnect ourselves to our loved ones and friends. So as we look at how we were going to distribute this, we realized early on that this was a very limited and precious commodity. It was distributed to us in limited supplies, which are increasing over time. We developed within our community a vaccine consortium, those phase 1 providers who will have access to these vaccines, and really came together jointly with a dedication to get every vaccine that is provided to us into arms of our residents in a timely and safe manner, while treating everyone with dignity, respect, and equity. We realize that one size doesn't fit all, and so we've developed a 3-pronged approach. And the first is just that day-to-day vaccine effort, and it's the brick and mortar, as I call it. Our vaccine providers have their sites, they have their facilities, and they can capitalize on those resources that they already have in hand to begin daily getting out those vaccines. And so we know that Matthews VU and Peak Vista can get out 500 to 700 vaccines a day, where UC Health at their MAC building can do up to 2,000 in a day. So we're beginning to get that supply out as it becomes available. But beyond that, we knew that we needed to be able to reduce barriers, whether it's language or transportation or accessibility. And so we began to develop those pop-up clinics that would go into some of the geographic areas, or utilizing non-traditional sites in which people might be more comfortable getting a vaccine rather than coming to a clinic. And so we've had some at our Fountain site down for public health, but also at YMCA, and are looking at utilizing some of our leaders that are trusted throughout the community to set them up in churches and some other avenues. And so it is important to be listening for some of those opportunities that may come not only geographically, but also into some of those sites that just are more comfortable in which to receive the vaccine. Also, there are the third prong, which is that max vaccine event. And I say that these are kind of the sexy events that create more enthusiasm and knowledge, and just the understanding and voice out into the public that the vaccine is available. And in seeing this many people, line up and get vaccinated, it encourages others to really consider getting that vaccine. So our phase 1 providers have been the hospital systems, Centura, St. Francis, and Penrose, Children's Hospital, as well as UC Health Memorial. We have Matthews Vu, Optum Health, Peak Vista Community Health Center as our federally qualified health center, Kaiser, and our pharmacies have joined in. CVS, King Soopers, Safeway, Walgreens, and Walmart are all at the table as we look at ways to get this vaccine out. Because of the mRNA being a more fragile vaccine, it has to be handled in really cold, super cold storage. It has a short half-life once it is thawed. It's really important that we had very dedicated providers as we moved initially forward. It's important for you to understand where your resources are for information and vaccine distribution. And honestly, we have hopefully promoted this from the very beginning of the vaccine, to know your resources, that they're trusted, as Mr. Lewis stated, that they're science-based, and that you can assure that they are laying to rest any of the myths. Public Health has information on their website at elpasocountyhealth.org, not only about the vaccine, but also who is offering it at this time and how you can connect with those providers, whether it be through the internet and their web connection or a phone number to call. It also gives information about the vaccine and potential myths, as well as facts that you may want to know and further information. The other reliable source in El Paso County for getting vaccine is through the 211 line. And there are people there that can answer your questions. And for those 70 and older, we are really pushing to finish that phase of our vaccine distribution. And so there will be a hotline that is set up that will be just for individuals who have already enrolled but have yet to receive their vaccine, so that we can assure that those numbers and names are connected with the providers, and we keep you at the front of that line and get you vaccinated, knowing that there are individuals higher risk, and that phased approach has been placed to try to reach those who are at the highest risk of either contracting the disease as a frontline worker and then spreading it, or in contracting it, having a severe disease or fatality. So those are some of the ways that we are moving forward. We're doing also an Operation House Call for individuals who may be homebound because of illness or other reason. And that is being done through the fire department, coming along in collaboration with our Medical Reserve Corps to actually take the virus out into the home. It takes a long time. They can only get about 6 vaccines per team in a day because of travel and all of the other things that are needed to take care of the patients that they're connecting with, and taking care that the vaccine is appropriately distributed. But it is an exciting new avenue that we're getting the vaccine out that started just this last Wednesday. So I wanted to end by speaking to a little bit about these vaccines, and Dr. Ellison and Dr. Pepe both touched on this, but both Moderna and Pfizer have about 94 to 95% efficacy, meaning that they prevent disease with any symptoms that 95% of the time. We are not completely sure of asymptomatic infection in the data or asymptomatic spread once you've had the vaccine. So that's why it's still imperative that we continue all those other preventive measures, wearing your mask, keeping social distancing, really washing your hands until we reach herd immunity. No tests were done on the mRNA vaccines on a 1-dose option, though those are underway with these 2 vaccines. J&J is coming forward, and we are anticipating that it will be available within the next week or 2 here in Colorado. It is 66% effective in preventing all symptomatic disease, but 85% in preventing severe disease or hospitalization, and 100% effective in preventing fatality. There's no significant differences in the safety profiles of any of the vaccines. So there are trade-offs around the 1 shot to some decrease in efficacy. And they are looking at Johnson & Johnson, a 2-shot series to see if they can reach the higher efficacy of Moderna and Pfizer. But the bottom line is that we need to get vaccinated when it is our turn, because it protects you, it protects your family and friends, and it leads us as a community towards that herd immunity that will allow us for more robust human flourishing, to reconnect our economy, our social, and our personal connections. So the supply chain is going to take a while to increase to meet demand. And so at this point, the most important thing is to get your vaccine when offered and get protected. So I want to again just thank you for the opportunity to be here. And I'm going to turn it back to you, Mr. Lewis, so that we can begin to entertain questions.